Alrighty then, I think we are ready to get started. This meeting will be recorded so that way we know a lot of childcares are working at this time. So it will be sent out. It'll be on our website and we'll also be sending out the PowerPoint presentation as well. So with that said, we'll go ahead and get started. My name is Joanna Nava and I'll present my coworker.
Hi, I'm Rafael Flores.
And we are the school and child care specialists here with the Imperial County Public Health Department. We will be reviewing and going over the California Department of Public Health's child care guidance on best practices, and it'll serve as a good reminder for all child cares as well, especially during this flu season and as we see COVID numbers are increasing. It'll serve as a good reminder for everyone as well. So we thank you for joining, and with that said, we'll be going ahead and getting started. So throughout this presentation, we will be going over briefly the introduction, what changed from previous guidance to the current one that is being put out by the state. That includes mitigation strategies, managing COVID-19 symptoms and cases, and then at the end, we'll have a little summary of all the requirements as well. There will be a time for question and answer at the end as well. So if we appreciate if you have any questions, we can save them for the end and then we can revisit any topics as well. Alrighty, so as we know, COVID-19 is here to stay. We have been seeing continued numbers locally. It has not gone away. And again, this guidance serves as a good reminder for providers and their families to have in mind the tools and strategies that we have learned throughout the pandemic. So we've been in this for almost 3 years now. And so we're using everything that we've learned as tools to better improve and make sure that we are avoiding the transmission of illness. And so we hope that by reviewing this guidance that childcare providers can feel more confident in their abilities to share this information with families as well. So here at the health department, we do our general outreach to communities. We have billboards, we have flyers, we have our social media posts, but I feel for childcares, especially providers, the better that they are capable of using this information, the better they can transmit it directly to families. And I feel like that has a more long-lasting direct effect on parents as well. So we hope that with this presentation, providers can be better equipped to handle questions and to provide guidance as well to families. So we'll see as well throughout this presentation links and references to California Department of Social Services, the California Department of Public Health, Cal OSHA, as well as our local county orders as well. So again, if there's anything that you as childcare providers are unsure about regarding the requirements and recommendations, we do urge you to ask us directly. Ask licensing, whoever you feel comfortable with, but we are here available to answer any questions on how to best manage your facility. Moving on, so what changed? Not much has changed from previous guidance that the state has put out, but in this guidance, you'll see that there has been a highlighted importance of vaccines. So we have vaccines available for COVID ages 6 months and up are eligible to be vaccinated. Again, there is a higher prioritization on optimizing indoor air quality. You'll see that as well in the mitigation section. And then you'll see also that antigen tests are preferred over PCR tests. They're easier, they're faster, they provide results that we can trust. And then lastly, you'll see it's not much of a change, but it just kind of emphasizes that childcare should be reporting outbreaks of any disease, not just COVID, to licensing and the health department as well. And we'll be going through these more in detail. So starting with the mitigation strategies. Again, we are compiling everything that we've learned throughout the pandemic, and you'll see in the next couple of slides as well how we can take multiple strategies, and the more we use them together, the better our chances of limiting lowering the risk of transmission of COVID. So we'll see again more in depth on vaccines, air quality, face masks, even now, even though they're not required anymore, testing as well, and overall cleanliness, disinfection, hand hygiene, and other things as well. So right here we see different mitigation strategies. And so these, we really want to keep them in mind when making decisions on how you will best be keeping your childcare safe. So we recommend to look at this as a layered approach. The more strategies you utilize, again, the better your chances at avoiding widespread illness. So again, none of these layers on their own is a perfect mitigation strategies. Each one has its flaws. For example, vaccines. It's a good mitigation strategy, yet it's not perfect because there's a lot of misinformation regarding vaccines. Parents don't feel safe. Some parents don't feel like it's safe for their children, and also not all children, especially those 6 months and younger, are eligible for them. So we know that childcares deal with babies in their facilities as well, and they are most at risk. So again, COVID-19 vaccine, it's not a requirement yet for vaccines to enter childcare, but it is strongly recommended. It says prior to admission, children are required to have vaccines referenced in Title 22 California Code of Regulations, and some programs, depending on your program, you may or may not have additional requirements as well. So you can find required vaccines for childcare on the Shots for School webpage as well. And also, right now, we have been receiving a lot of calls, not only COVID, but flu as well. And we want to follow kind of similar recommendations when dealing with COVID and also when dealing with flu. So we do have the vaccinations for flu every year. Anyone 6 months and older can get the flu vaccine. And those who have actually already tested positive for flu this season, they're still encouraged to get the vaccine for flu after a month of testing positive, as long as they don't have symptoms. So anyone can make an appointment online at myturn.gov, and they can also come into the health department and be vaccinated here at our local health department on Main Street. Again, and then moving on to indoor air quality. Again, this is a mitigation measure that the state has been prioritizing and pushing. We know daycares, at least most of the ones that we work with, operate out of their own personal homes. So providers can do their best to try to optimize indoor air quality. They can find information online, which we will reference in the last slides at the end. Title 22 does recommend or require that providers establish and provide safe and healthful conditions, that they ensure clean, safe, and sanitary buildings. And it's always a good thing when we can better our air quality. We spend most of our time indoors. And so how can we improve indoor air quality? Well, we'll be seeing in the next slide as well an example of how providers can optimize indoor air quality. They can introduce portable air cleaners, the types that you buy at the store, but we know those are sometimes expensive as well. And we do have another option of creating our own portable air cleaners using filters, and we'll be going over that as well in the future present slide. Moving on to masks. So masks continue to be an effective and inexpensive tool to protect ourselves. Children 2 years of age and older are recommended to wear a mask, especially after exposure when sick and when around a lot of people. Childcare staff are required by Cal OSHA to masks for 10 days around others after being exposed to COVID-19. And of course, there is still exemptions to masks. You never want to place masks on babies or children under 2 years of age, never while sleeping or while eating. Also, when it's hot outside, we don't recommend wearing masks due to concerns of overheating as well. Moving on to testing. Testing continues to be an important mitigation strategy. It can help diagnose someone or screen someone even when they don't have symptoms. So that's why after being exposed, after coming back from break, it is highly recommended to test And it's really encouraged for families to have their own test kits at home. I know here, childcares can request them from the local health department or from their programs as well to give out to families as well for them to have some. So again, testing before returning from Thanksgiving and winter break can help identify cases before they have symptoms or to diagnose symptoms prior to returning. Unvaccinated employees are no longer required to undergo weekly screening testing. That was effective September 17th, 2022. Workers are no longer required to test weekly when they're unvaccinated. So that was a few things. Regarding the last strategy, maintaining clean hands, good respiratory hygiene. Providers are required to train and monitor staff to follow universal health precautions and preventative health practices. So it is recommended to teach proper hand washing, ensure adequate supplies are available, such as soap, tissues, hand sanitizers, but also you want to be careful and make sure that any sanitizers are stored in somewhere where children cannot see or reach them. It's also good to continually remind staff and students as well to cover their coughs and sneezes and also wash their hands after doing so. Regarding more mitigation strategies, you can also visit the CDPH childcare guidance. It goes into more detail regarding food service, stable groups, and meal times and things like that that are good because in previous guidances from the state, there was a recommendation to separate students and kind of isolate them while eating. Now it's kind of changed where more family style is recommended due to the social aspect of it, and we don't want to limit children from that as well. So moving on, as we talked about portable air cleaners, you can see in this first picture a way to improve indoor air quality. If you don't want to buy a portable air cleaner, you can make one low cost and it works just as well, if not better than those that you buy at the store. So as you can see here, this right here is a Corsi Rosenthal air filtration box. These 4 panels on the side are actually MERV 13 air filters that you can buy at the store. At the top is a box fan, and at the bottom is a piece of cardboard. You tape it all up very well, and you'll see that right here below, dirty air goes through these panels, and it comes out filtered through the top. So we are actually working on a campaign on focusing on optimizing indoor air quality. And so we will have a video posted on how to make one of these yourself on our website soon. But for now, I'll be sharing in the chat a little later ahead to a link on where you can find these, on how to make these as well. Right here in the second image, I have been asked by a childcare provider recently. She said, what is or how do masks even work? And so I really liked this diagram here. It kind of just reminds us of visually on how we can be best protected against COVID-19. So you can see on the top, the infected person is not wearing a mask. They might not know that they have COVID. It says they are asymptomatic, but we know that even if you don't have symptoms, but you've been exposed, let's say, and you are barely developing symptoms, you can already be infectious towards others. So we see at the top, she is not wearing her masks right here. And she is speaking to 2 people right here. This person is wearing a mask and this person is not. Right here, we can see maximum exposure between an infected person who isn't wearing a mask and another healthy person who also isn't wearing a mask. This is the maximum exposure. Here at the bottom, we can see the infected person is wearing a mask. There is less droplets. And this person who is also wearing a mask has the minimum exposure, so very much lowers the risk of becoming infected when both parties are wearing a mask. And lastly, we put this little diagram of hand washing steps, always a good reminder to post around childcares, workplaces, anywhere, to kind of just keep reminding ourselves exactly how long to wash our hands or what situations to do it at. Alrighty, and so now we will be moving on to managing COVID-19 symptoms and cases. So we'll be seeing how you can manage staff with symptoms, students with symptoms, those who have been exposed by COVID, particularly family members. We see a lot, we get calls from childcares asking us like, hey, my student was exposed by a parent. What should we do? What are the requirements? So we'll be going through that as well. Also, when you need to report to us um, and follow-up details. So I'll leave it to my coworker, Rafael Flores.
Thank you so much, Joanna. Welcome everybody once again to our childcare guidance presentation. As Joanna mentioned, we're moving on to the management of COVID-19 symptoms and cases. So for individuals with symptoms, some recommended practices are for providers to develop standard criteria for managing people who develop symptoms, which this basically consists of developing a plan of action for when a exposure event or any outbreaks occur. And that could be dealt directly with us. We could provide guidance towards developing, if not yet developed, a plan of action for that. Also, some recommended practices. If symptoms are concerning for any student or staff, it is strongly recommended to mask and get tested immediately. If any symptoms at all relating to COVID-19 should surge, we do recommend to stay at home and get tested immediately, just to discard that, and which really helps stop the spread, and lower the risk of spreading not only COVID, but other infectious diseases currently going on. As far as for requirements, providers must take action to exclude any child or parent, caregiver, or staff showing symptoms of a contagious disease, which could be anything going on right now, which includes COVID-19, influenza, RSV, which are the viruses currently going around the community. And also, for as far as requirements go, isolated children must continue to receive adequate care and should be monitored at all times. They shouldn't be unsupervised and should be have all their needs met, as every children experiences COVID-19 or other infectious diseases differently. And this is definitely something that needs to be overlooked by an adult and someone capable of managing and monitoring their symptoms. Alrighty, moving on to the next slide. So just a chain of flow of tasks that should be taken in order to report a case or an outbreak in this sense for COVID-19 to us, Imperial County Public Health Department. So when you receive a notification from a parent, or a parent in this case, or a lab, that a child was positive at your site, you should immediately try to notify all close contacts within that classroom or site. And that's serves best just to, have all children protected and maybe isolated as soon as possible, just to make sure the spread stops. Also, if there is 3 total positive cases within 14 days, we would consider this an outbreak. So that needs to be reported, or a possible outbreak. And then following that, you could access our online form on our website, where we'll make sure to also share that in the chat. And you could contact us to investigate further, but we would definitely contact you in order to just make sure those cases are accurate, and just continue monitoring if any other additional cases were linked. And yeah, that would be the basic chain of task flow that would occur in order to report outbreaks to us. And that doesn't only have to be COVID-19. It could be any infectious disease currently that's going on. And also a requirement in this case would be to report any death of a child by any cause by phone or fax within the next working day. Alrighty, moving on to the next slide. For children and staff diagnosed with COVID-19, children are recommended to follow the CDPH guidance for general public. They must stay home for a minimum of 5 days and wear a mask around others for at least 10 days. Children under 2 years may discontinue isolation after day 5, and testing is not necessary. Children older than 2 may discontinue isolation after day 5, but for children older than 2, testing is recommended. For staff, staff is required to follow Cal OSHA requirements. So they must stay home for a minimum of 5 days, only return if symptoms are not present or resolving, and a diagnostic specimen is collected on day 5 or later that tests negative. If an employee continues to test positive or is unable to test or not willing to test, they must stay home for the full 10 days. Alrighty, moving on to the next slide. This is just a illustration or a compilation of all the information you can find concerning vaccinations, cleanliness, managing individuals with symptoms, reporting, and managing individuals diagnosed with COVID-19. As far as for CCR, California Code of Regulations, these are all requirements that need to be met. For example, for vaccinations, all requirements under Title 22 for childcare settings and sections 1024-18 for family childcare homes apply. So that this requirements need to be met by law. Also for cleanliness, under Title 22, under these sections specifically, it is really helpful to just, have everything legally met, all the requirements legally met. It's really beneficial to have a closer look at these laws. And also, we have some information here from CDPH, California Department of Public Health, which includes some shots required for schools and preschools. COVID-19 improving indoor air quality for schools, which is just the guidance and some resources provided by the CDPH to better optimize indoor air quality. And then for reporting, CDPH also has the outbreak definition and reporting guidance for childcare and managing individuals with symptoms as well. For Cal OSHA, we have some information regarding managing individuals with symptoms, which include California paid sick leave. For reporting, COVID-19 prevention emergency temporary standards, which need to be met by all employees. And as well for Cal OSHA, managing individuals diagnosed with COVID-19. This is a really nice quick sheet to illustrate what employers need to meet or employees specifically in case they are asymptomatic, symptomatic, or test positive. We also have some information as well. Yes, of course, we'll definitely send out the slides as soon as the presentation is over. We also have some information here from the CDSS. So all of these links are really, really valuable and really helpful just to get a closer look at the information and really grasp the bigger picture or what is really specified or required by law and also by or recommended by the Department of Public Health. Alrighty, now moving on to the next slide. This is a quote we liked. We took off the Child Mind Institute, which states, COVID has put every child in the state of California and the nation under unprecedented stress, personal trauma, economic and learning loss, and continuing uncertainty. We thought this quote to be really true and really resonated with us, because it's something that we've experienced ourselves, and we've seen the just unprecedented amount of stress that the pandemic generated, but at the same time understand that the importance of resiliency in this case, and just continuing to motivate our children. Alrighty, so yeah, some more links, some more resources here from the ourselves, Imperial County Public Health Department, the Department of California Department of Public Health, and the CDSS. These are all super valuable resources, and we'll make sure to share them out.
Yes, thank you. Yeah, we'll be sure to send out all these slides as well as the recording of this video. Before we end, though, we would like to extend the invitation for any questions as well. Feel free to put them in the chat, or after the presentation is over. We are available Monday through Friday here, 8 to 5, with any questions as well. So we just did jot down a few questions that we have received so far. The first one, what to do if a child has symptoms but tests negative? And so the answer would be any child who develops new unexplained symptoms should not return to a facility until it is clear that symptoms are mild and improving, or due to a non-infectious cause such as allergies. This includes waiting until 24 hours have passed since resolution of fever without the use of fever-reducing medications. And so I know we've spoken to a lot of childcares recently who say like, yeah, we have a lot of sick kids, but I mean, their parents keep bringing them, they have to work. And so we understand that as well, but we need to keep in mind the recommendations and avoiding any potential transmission when we can do something about it, such as making sure we stay home when sick. And so they might not be testing negative. We could, so, you know, if they don't have a positive test, it's still a good idea to not allow students or children with symptoms to be present with other children as well, because then we potentially cause a big risk to other families, other healthy children as well. So in order to best lower the risk of an outbreak, increase transmission, it's best, especially during these winter months and flu season, to avoid anything like that and ensure that families are well aware of the recommendations and requirements. Going on with question 2, it says, what if the child care provider or a household member tests positive? Can the daycare remain open? For situations like these, we do recommend that we receive a call from the child care to know the full scope of the situation. And so this is a general basic answer, but we do still recommend to communicate with us whenever this does happen so we can provide, you know, specialized guidance. So it says, if the provider has symptoms or is infected with COVID-19, the provider should close unless they can isolate from childcare attendees and other staff. So it says staff who test negative and have no symptoms can provide care for the children while the provider is isolated. And so again, this is kind of an overall general answer that for the most part, if a provider tests positive, we would generally, you know, recommend to close the child care facility while they are doing their isolation days or while they recuperate with other symptoms if it isn't COVID related. So meanwhile, during that time, if the child care provider wants to stay open and she has willing staff that is completely healthy, negative COVID tests, and can provide care for the remaining children who are also, you know, healthy, then that is also possible. Moving on to the third question, it says, where can I take my child to get a COVID-19 vaccine? So right here, again, when we share out the slides, you'll be directed to that link, myturn.ca.gov, I believe. And so there's our local health department. You can give us a call as well and make an appointment online. But I know if you want us to make any appointment for you, again, like we can walk you through the process. It's very simple as well. And we hope that, you know, providers can share it with families as well to make sure that they know what is available here locally. Alrighty, so I'm not seeing any questions in the chat, but here is our contact information, phone number, email you can reach us at quite quickly. We also have the main Imperial County Health Department number, 442-265, what was it again? I forgot, 7444 or 1444. And so you can find it online on our website as well. And feel free to reach us directly as well with any questions. So we thank you for joining. This was the English presentation. We will be having our Spanish presentation in a couple of minutes at 2 p.m. for anyone who would like to rejoin or anything like that. We thank you for joining. Our presentation will be uploaded on our website soon. Also, we will be providing a couple links right now, I believe, if I can share my screen again.
Yep. Thanks so much. And if you have any question or doubt, please feel free to ask anything you'd like. We're open to answering anything currently for childcare guidance.
Yes. And so right here, I don't know if you can see my screen. You can see our Imperial County Health Department website. So basically when you go onto the homepage, right under COVID-19, you'll find school and childcare administrator resources. Right here is we have the most up-to-date information, a link to the Safe Schools hub. Oh, actually our video is already uploaded. I just noticed. You can find a video of us of when we constructed a DIY portable air cleaner. Very cost efficient, and you can make one yourself for your childcare facility. You'll find state guidance, childcare resources, including most links that we included in our website, presentation as well. A link on where to report cases and outbreaks, and previous videos as well. This was for K through 12, so right here you'll be able to see our childcare one once we upload it, as well as where to get vaccinated. You can schedule an appointment or find the further testing resources. Well then, I think that is all on our end. We would like to thank everyone again for joining, and we will be contacting you through email with sharing these slides. Thank you.
Yep. Thanks so much.